Hi, I'm Gleason. I just want to thank you guys all for coming out today, and I'm here to present my idea of starting small. So after my phases of wanting to be a rock star or a Disney princess, I decided a couple years back that I wanted to major in public health. Ever since I've been surrounding myself with community service, such as being an altar server at church, Girl Scouts, and just volunteering in local different clinics, and I think I can get my hands on to. So what I started 2 years ago, I started at a small hospital, and here, I was hoping to, hopefully interact with patients, create relationships like that. And so I found a small hospital that had a program for kids 16 and up, and they got assigned to different units in the hospital, and I was assigned to the wound care center. Here, I was hoping that I would be able to, get someone a bandage if someone came into the wound care center with a scrape on their elbow. Or even be able to interact with the patients and hopefully, stay in on a patient's visit just to learn more about hospitals. But ultimately, I did 87.5 hours of paperwork, so that wasn't really what I was expecting. And so the next summer, I tried 2 bigger hospitals, thinking that, because it would be a bigger name, a bigger hospital, that maybe I'd be able to do something more that I wanted to do. However, I was still stuck doing 87.5 hours of paperwork and labeling chart after chart. So moving forward. So after those experiences at those hospitals, I tried a local project, and that all started when I took my course Philanthropy 101 with Mr. Ballingy in the summer. So what exactly is philanthropy? Philanthropy is the act of helping people, whether it's giving your talent, money, or time to help another one's life. So that could mean either doing 87.5 hours of paperwork, or it could mean donating to UNICEF that comes around every Halloween and says $1 will save 20 families and feed them for 5 years. And this is where my idea of starting small came from. We had a speaker, Laura McKenna, come in for Philanthropy 101, and I was having a hard time trying to find a local organization that I could help, which was surprising because the hospitals were a lot easier to get into and find volunteer projects for. So after Laura McKenna spoke, she talked about her service work that she has done and still currently does. And so after she spoke, I ran down the hallway to try and introduce myself, to see if she could help me out with some advice. And after numerous phone calls and texts, I began my first day at the Free Catholic Worker Free Clinic. So the clinic is a nonprofit clinic, and it offers free healthcare services, free physician services, free dental care services, and it's just a basic outlet for anybody who needs support, whether it's coming in to get vitamins or just needs someone to basically talk to. This definitely changed my life, and it was something I was not expecting going into it. I saw kids my age, and also kids various ages. I've heard and seen stories of drug overdoses, suicide attempts, which I actually met a guy a couple weeks ago who was extremely suicidal and jumped off the Ben Franklin Bridge, but miraculously survived. And I've also seen and heard of domestic violence stories. One drug overdose, actually a woman came in about a month ago and had a heroin overdose and just had a seizure right on the floor where we were. So, seeing those experiences, looking back on it, I had no idea what I was in for. And then here are just some of the pictures that I've captured from the neighborhood in Kensington. So what I've learned from the Free Catholic Worker Free Clinic, to me, it's basically a complicated, tight-knit family. So when the woman that I was speaking about earlier came in and has a seizure on the floor, the patients there, calmed the other patients down who were reacting to the situation. I really got to see how everybody needed all the support that they could get, and they really were a family and really were helping each other. So what exactly you can get from starting small versus volunteering at different hospitals and bigger organizations is able to be more of service. I can take vitals at the clinic, I can interact with patients, and just knowing that and seeing that them leave with a smile on their face really makes everything worth it, and also increases your own experience so you can get you can actually like see what like the bigger problems in our society actually are. And once you do that, it allows you to start to tackle the bigger issues. So domestic violence, bad education systems, and also poverty. So knowing what is actually going on in society is incredibly helpful. I'm really bad at this. All right, okay. And then here, a couple months ago, I did a drive at Penn Charter for the clinic, and I interviewed a couple of the patients. And I just wanted to show you a short 20-second clip of one of the patients, and he tells about how much the clinic means to him. There's audio, I promise. Well, he talks about how much the clinic means to him and how incredibly helpful they are to him. And his name's Roger, and he's been a patient at the clinic for 6 months now. He actually dropped out of school in 10th grade because he was following the popular kids and got into a lot of drugs. But now he's back on his feet because of the clinic, and he talked about that. Okay, and to sum it all up, basically what I've learned is that the care we can provide just in our communities is limitless and affects more people than we actually know. And starting small means like starting in our community. And once we do that, we can see how far that actually reaches and how far it actually goes, so it can change into our society as a whole. Thank you.